Hi everyone, I hope you're all well. Today in Between Patients I want to talk about the nostril retainers. Why do we use them and why they can be life-saving. First of all, nostril asymmetry is something very common after rhinoplasty or septal rhinoplasty surgeries. The reason why is the nostril shape, size is, it depends on so many different factors like muscles around it, like the maxillary bones asymmetries, teeth asymmetries, nasal bone asymmetries. As the nose is sitting in the middle of the face on an actually bone structure of the face, any asymmetric differences in both sides can heal with an asymmetry. For example, if you're having septal rhinoplasty surgery due to a septum deviation, the nostril size to start with, it can be asymmetric, and even if you fix the septum into the middle, after a while the septum memory hits and it can still be a little bit deviated, that change the shape and the size of the nostril again. And if you're having teeth problems, if you're having asymmetric cheekbones, asymmetric orbital rim, they can all affect the shape and the size of the nostrils after the surgery. So that is not something we promise to our patients after the surgery, but we can improve them by using these retainers. So these retainers are actually pushing the soft tissue envelope a bit apart and then stretching the nostril size. So after the surgery, let's say you had the surgery a couple of months ago and you noticed a bit of nostril asymmetry is kicking in, and let's say my right side is narrower than the left side, so I actually use the hard part of this nostril retainer and cut it into a half and use this inside my nostril just to allow it to stretch actually the soft tissue. And I use it throughout the day or during the sleep for 2 months, and you will see a very noticeable difference, improvement actually. And if as time passes and this nostril starts to get bigger, you will need a bigger size. You can get them in different sizes, so you can also use the soft cover of the hard ones that you can actually connect them, that makes them slightly wider, and you can use them instead. So while sleeping, you can actually use this so it doesn't slip in, or you can actually use a tape to tape this actually. So these can be very useful. You can get them from Amazon as well, and they will help a lot to balance the nostril shape. As a summary, nostril asymmetry is can be a bit annoying, but it's something that depends on so many things: muscles, the skin, the way you sleep, the way your the mimic muscles are, the way your nose actually sits on the asymmetric or uneven bone structures, the teeth, the orbital rim, the height of the cheeks. If they're not symmetric to start with, probably after the surgery you may expect a little bit of nostril asymmetry as well. Okay, and if you need help, if you need any question, if you need to ask any questions about nostril retainers and how to use them, you can always ask me, send a video or picture, or even come in to try this. And if you need me, I will see you soon.